You put your skin through a lot.
But skin is precious. It tells your story like nothing else can.
Scars, moles,
wrinkles. I've enough of those, thanks.
That's why it's so important to take care of it.
I wish I had.
but Irish people are not treating their skin as well as they should be.
So from all of us to all of you,
this is a skin intervention.
In Ireland, rates of skin cancer like melanoma are increasing faster than any other type of cancer.
We were all diagnosed at different ages.
at different stages.
It started out with a all the way back.
My thigh.
My left forearm.
My ear.
At the moment, my treatment involves surgery every few months. And every few months, when it reappears, I go back to the very first time and I live through the fear and the worry.
But we don't want that to happen to you.
You mightn't think you're doing any harm.
Sitting out in the sunshine without protection.
Maybe you think you're young and invincible.
Or maybe you think you're past the point of developing it.
But it can happen at any age.
Skin cancer took my sister Sinead a week after her 31st birthday. She loved life. She did everything for her family. She was the most thoughtful person. I miss her.
Sunbathing and sunburning are two of the biggest causes of melanoma.
But just one bad sunburn before you're 18 could increase your chances of skin cancer by half.
Using a sunbed, even just once, increases your risk of melanoma by as much as 20%.
So please, don't put your skin through that.
But there is some good news.
You can be vigilant against melanoma by checking your skin on a regular basis.
Get to know your own skin.
And look out for any changes in moles or freckles.
Things like colour, size and shape.
And if you do notice something changing, visit your GP as soon as you can.
Because when it's caught early, it can be treated.
I have been lucky that I got a second chance.
So now that you know the risks, please treat your skin with more kindness.
And your children's skin too.
And tell everyone you know to do the same.
Share this message with your sister,
Your brother,
Your parents.
Your partner.
A young person heading off on their Leaving Cert holidays.
Share this with everyone you know.
Because skin cancer does not discriminate.
and remember, this intervention could save their life.
I caught it early and I survived.
Good evening, everyone. You're all very welcome to our Men's Health Awareness webinar series. It is very timely that we talk about skin cancer this evening. What a beautiful day we've had, and hopefully we'll continue to have, through the next few months. A nice summer is what we all need at this time. But you have heard it here. Skin is precious. You can develop skin cancer at all ages and be diagnosed at different stages. I would like to acknowledge Anne and her family here, who has since died from melanoma, who partook in this video. We know that sunbathing and sunburning are the two main causes of skin cancer. And Dr. Ormond says, do not do this. He also says, do not use sunbeds. If you see changes on your skin, visit your pharmacist or your GP. When things start changing, don't procrastinate, get connected, re-engage and look after your health. Remember, skin cancer does not discriminate. So I'd just like to say you're all very welcome. The Marie Keating Foundation are very passionate about, working with men. One of the reasons we are in that sense passionate about reaching out to men is that we know that cancer is the leading cause of death at 33% amongst men. Second in line to that is circulatory disease or heart disease at 29%. And then thirdly is respiratory disease at 11.3%. We listened about skin cancer at the beginning. Non-melanoma skin cancer has doubled since 1994. So it's gone from 2,826 to 6,621. And that was in a report in 2017 to 19 from the Men's Health Numbers report. But actually today we know that skin cancer is the most common cancer in Ireland. Today we know that over 13,000 people are diagnosed with skin cancer. 7,000 of those are males. And that's a 1 in 6 chance of being diagnosed in a man. Over 11,000 of those cases are non-melanoma. So that's not what we talked about in the video there, but non-melanoma are basal cell cancers and squamous cell cancers. And men have there's 583 diagnosed in Ireland with melanoma, and men have a 1 in 12 chance of developing it. Prostate cancer, as we know, and we hear a lot more about prostate cancer, is the second most common cancer for men. So there's about 3,474 men diagnosed in Ireland every year with prostate cancer. And that's a 1 in 8 chance in men over 75 years of age. Followed by colorectal cancer, it's the third most common cancer. We see about 1,644 cases diagnosed. That's a 1 in 21 chance of being diagnosed with a rectal or bowel cancer. And then fourthly is lung cancer, with about 1,400 men diagnosed. That's a 1 in 23 chance. But I suppose the important thing for us all here is to know that in most circumstances, we can help ourselves, and that is why we were here. This is for men and for the women in your lives, for those of you who have concern about your overall health, who have had a cancer diagnosis, completed treatment, and come out the other side to a new normal, but also for those who find themselves on a continuous journey of treatment, and that can be difficult. But it's important, to acknowledge that everybody is on a similar journey, not always the same, but are in need of help and support and knowledge also. So please do sit back and take home what is important to you from today's session. This evening, of course, is all about men's health awareness and support, and we are here to celebrate that. This is week 3 of the series, and today we're going to learn more about access to your pharmacists on the high street with Kathy Maher from Duleek Pharmacy. I would also like to give a shout out to Jim Curran, who is a member of the Men's Health Forum Ireland and Director of Strategy and Operations for the Irish Pharmacy Union. It's fantastic to work together with the pharmacies of Ireland. I will introduce Kathy, our keynote speaker, shortly. But just to let you know that there are other webinars available. Last week, we talked to Lurkin Brennan from the Men's Development Network. And we heard him speak quite passionately about better lives for men, better lives for all. And then during our first week, we heard from Dr. Mark Rowe, who has a podcast, GP in the Chair. And he talked about finding happiness and vitality and how we can manage our mental health through discussion. So hopefully by the end of this hour, we will be well versed on what we at the Marie Keating Foundation can offer you and how the local pharmacy can play a vital role in your health, our men in Ireland, but also how important men's health awareness is to us. We often are seen and have been for many years known to support women with breast cancer, but that has all changed. So do keep an ear out over the coming weeks to learn more. So before I introduce Kathy, let me tell you a little bit more. The World Health Organization states that a healthy man is one who is empowered to experience optimum physical, mental, and social well-being, and experiences health as a resource for everyday living. Ireland was one of the first in the world to adopt a national men's health policy in 2009. And I know all members of the Men's Health Forum Ireland have had an opportunity to partake in that. And we should be very proud of that. Dr. Noel Richardson wrote an article in the Sunday Independent on Father's Day. And he said that men routinely make smart choices. They do actually make very smart choices when it comes to their livelihood, but struggle with self-care. So that's really important, I think, for every one of us to remember. And that's where, the support comes in. I'm Helen Forrestal and I'm Director of Nursing at the Marie Keating Foundation. I'm delighted to be here with my team tonight. Ava is in the background there managing the IT support systems. And we have Mari, our community nurse from the West, also going to chat with us tonight. So as usual, we are live and this is being recorded. We're also streaming on Facebook. We would love you to participate in the webinar. And if you have any questions that you'd like to ask, please put them into the Q&A box at the bottom of your screen there, and they will be answered at the end of the webinar. Likewise, if you're on Facebook, you can put a question into the chat there or into the page, and Ava will manage that and we'll be able to answer that too. So I would love you to participate anonymously or by name, whatever you wish. It's more important that we actually get a connection going and a little bit of interaction. And sometimes it's easier, to answer questions online or to even ask a question online than it is face-to-face or person-to-person. So use the opportunity where you can. Okay. And that webinar, the webinar recording will be available to everybody who registered, and it will also be available on our website. So I'd like to tell you a little bit about what the Marie Keating Foundation has on offer over the coming year. I know we've all struggled through COVID, and a lot of our services have transformed from face-to-face community to online. We're very grateful that we're able to do that. We also understand that it has advantages, and it can have some disadvantages in that, there's a lot of loneliness, I think, in COVID, particularly with men, and isolation. So we're very mindful of that. But just to let you know that we talked about skin cancer earlier on. We have a Talking Melanoma podcast, which has 8 episodes. And that is running at the moment. I know we've episode 1, 2, and 3 are available. You can actually use your Spotify, or you can, if you have the podcast app, you can use that, or you can actually quite simply go to our website and listen to the podcast from there. They're very easy listening. You can do that while you're out walking on a sunny evening. But the messages are fairly clear as well in what we should be doing. We talk to radiotherapists, we talk to oncologists and dermatologists, nurse specialists, and patients themselves. So it's a really good listen. And I know we're converted to podcasts to some degree, and you can actually learn an awful lot from them in a very informal way. We do community webinars, and we also run a Survive and Thrive workshop. And this is an 8-week program for those who have come through a cancer diagnosis, treatment, come out the other side, and are trying to manage in a new normal for them. That is acknowledged and recognized, and it can be a really difficult time in transforming from somebody who saw themselves as having lived a normal life to somebody who is living with and after cancer. So really important program. We have a BRCA support group, and you might say BRCA is a gene alteration in breast cancer, in ovarian cancer, and also in prostate cancer and in skin cancer too. So again, that's a support service that is available online. And if you are in need of any of that kind of support, check out our website, mariekeating.ie, and you'll find information there. We also run positive living programs. And to date, we have run positive living programs for women with metastatic breast cancer. So that's women with breast cancer where the cancer is spread to other parts of the body. They're on ongoing treatment and are often in need of quite a lot of support around uncertainty, anxiety, and all the stressors that have come to the fore in COVID, and again, isolation and the unknown. So they're all very supportive services that are available. We also have a community outreach service, and I know we're going to talk a little bit about that. We could find ourselves up in Duleek Pharmacy outside working with Kathy, and Kathy will tell you a little bit about that. And we'll talk to Mary about that also as an experience and a partnership in care. We have a schools cancer awareness program. And young boys, in fact, I know we're talking about men's health here, but I'd home in on and focus on young boys in school between the age of 15 and 34. They are at that age where testicular cancer is a key factor. It's low in numbers, But young men at that age, at 15 and upwards, need to be aware that actually it can, be part of what could happen to them in that age group. So that's very much something we do in the school's cancer awareness program, together with skin cancer awareness, breast cancer awareness, and vaccination as well, HPV vaccination for young boys in first year of secondary school. We have a Survive and Thrive website that we're developing further at the moment. And again, that's a photograph of us working with Solace Cancer Support Centre in Waterford and Dr. Mark Rowe, and Peter Jones was there from Get Men Moving. So you can see that we can work in partnership with a lot of different groups to make a huge difference for people who have been diagnosed with cancer, or actually to prevent cancer in the community, and to provide that information and support. And we also work with, I suppose, on some of the underserved communities. At the moment, we have a project running with social and inclusion groups. They're local development networks. We're working particularly with Roscommon and Offaly. And we have actually translated, together with their help, a webinar on cervical cancer awareness into Arabic. So the Syrian women have attended this webinar, and we have engaged quite strongly with them around particularly cervical cancer awareness and screening in Ireland. And that's been hugely successful and being well evaluated. There's a lot more work to be done there. We also work with traveller community groups, and I would acknowledge that, you know, their priorities have changed quite drastically over the whole COVID pandemic. And we're just beginning to re-engage with some of these groups now, where we can actually talk about reducing risks of cancer, being aware of certain kinds of cancer, and actually engaging on a greater level in the community when we can open up again safely. We've done a lot of campaigns for men, but, you know, well, these campaigns are particularly around men's health. And some of them have been really impactful and a bit tongue-in-cheek. So this one here on Bell is I Gave a Shit campaign, and it saved my life. So really important, you know, your ears like prick up and you say, what did they say? And you begin to listen in to what's happening within that campaign. So really successful campaign. We also, year on year in September, we actually celebrate, you know, Blue September. So we look at developing knowledge, information, and for men and with prostate cancer, or for their families. So that whole engagement in what prostate cancer is, the signs and symptoms, and where you can go to get help. So in this photograph here, we had a Heroes for Hope campaign, which was 14 men telling their stories. There was a couple of celebrities in there, like Tony Ward, who, again, you know, he's the hook where people listen up and say, what's he saying? So really important messages. I don't know if any of you heard our May campaign this year around bladder cancer. Give bladder cancer the red card, and you've got Davy Fitz there with his red card. A very simple message: see red in yellow, go to your GP. See blood in urine, go to your GP. Really simple messages that have really, in fact, we've been complimented on it, and it has been easy listening and easy learning. And then you'll see there we have a Stand Up for Your Prostate campaign, which we ran last year with comedians and the year before with sports celebs. So Tony O'Donoghue, Tony Ward. And this year we have PJ Gallagher there, and we'll be listening to Al Foran at the end of this presentation. So it gives men like the opportunity to listen to health in a different way. And it can be a little bit easier on the mind, and easier to kind of drawn in and engage with it. So other campaign, you heard a little bit about skin cancer awareness there. So we did the skin intervention, a really impactful campaign. You know, the young girl there who lost her young sister at only 31 had a great impact on younger children. So it really is to be more vigilant and to listen up and know what is going on, you know, in cancer awareness. And learning from it, and maybe changing behaviors to some degree. So Get Men Talking, of course, that follows year on year on year. And we are hoping this year that we're going to listen to men themselves, again, with prostate cancer, and what they have learned through their cancer journey and continue to learn, and where they get their support from. And I am really happy to say that we do a Look Good, Feel Better for Men. We work with Look Good, Feel Better. They're a not-for-profit organization as well, struggled through COVID, but they've been very instrumental in actually, supporting women online with makeup tips, with like looking after your skin, looking after your hair, looking after your nails. And we're actually doing the same for men. So we have a program coming up in September. And at the end of that, we're actually going to encourage men to come in and into this session and actually learn how to look after their skin. Not most men can, but it's just learning. Every time you listen to a webinar like this, you learn something new. So keep an eye on our website, keep an eye on our events page. There's much, much more coming up. And I suppose in the final week of our Men's for Health webinar series is on the 12th of July. That is Get Men Moving, and that's Peter Jones from the Waterford Partnerships Sports Group. And he's going to talk to us about how this has been for men and their families. And he's bringing along 2 men to talk about the effect and the impact in a positive way it has had on them. And that's always really nice to hear. And it's very encouraging and motivating for other men to hear that too. I talked about our Survive and Thrive program. We have a male Survive and Thrive program running, starting on the 14th of September, running for 8 weeks. That's an evening program. So if you're at work during the day, you can tune in the evening without too much difficulty. That is facilitated by myself as a healthcare professional, and also by Paul Power, who is a survivor of prostate cancer. So the combination of facilitation is really nice, and that somebody has experienced it, and somebody has actually, I suppose for myself, I've nursed in that area, and know what people collectively go through as well. We have a male positive living program coming up. And again, I mentioned about metastatic breast cancer. This program will be for men only, and it will be for men with any types of cancer that have spread to other parts of their body. It actually runs from 12 to 2 p.m. So it's a nice time, lunchtime. This group of men would be on continuous treatment. So I'm really hopeful that anybody who's out there listening, and if they know somebody who is in need of this kind of help or support in any of these programs, please do invite them to visit our website, mariekeating.ie, or to ring into the office on 01 628 3726. And we would absolutely be delighted to help and support you in whatever way we can. Cancer prevention itself is something we do on a very regular basis. Wherever you work, it could be in social inclusion, it could be in the community, on webinars, in corporates. So we're making every contact count here. Every time we meet somebody, we're talking to them about maintaining a healthy weight and diet, and keeping a healthy diet and what that is, physical activity and what that means and how much you should do or not. Alcohol limitations, again, talking about alcohol, the units, allowing people to understand, the units of alcohol. Not everybody does, but it gives us an opportunity to talk about, what the risk factors are for certain kinds of cancers and what we should do and what behaviors we can change. Smoking cessation is always a very powerful, I suppose, project and discussion for those who smoke, because we know that smoking is often stigmatized. We're trying to move away from that as much as possible. And what we're trying to do here is support people who smoke. And I'm sure Kathy will talk about that in her pharmacy services as well, because that's where people, need to be guided towards. Sun safety, we talked a lot about skin cancer already, and cancer screening. So for men in Ireland, it is bowel screen at the moment from the age of 60 to 69. And we would encourage everybody to avail of that. And then vaccinations, I suppose vaccination, when we talk about vaccinations these days, we talk about the COVID vaccination. What did you have? When did you get it? Have you had your second one? And I know we're going to hear a lot more from Kathy about that too. But really interesting discussions. In these pillars, we're talking about vaccination, probably in young boys for the human HPV virus, which can cause head and neck and deep throat cancers. I'd like to introduce Mary. Mary Dempsey is our community and online information nurse, and Mary lives and works from the west of Ireland. Mary has many years of experience in oncology, nursing in Ireland and in the UK, and has worked extensively in acute hospitals and in clinical and managerial roles. Maher joined us in 2016 as a community information nurse, and Maher is brilliant. And I have to say, in COVID, Maher has been so flexible, and we needed that because our community services actually stopped running for the majority of the time. But we transformed to online, and we've learned new skills, and we're getting great evaluations on the work we do. So I'd really like to say a really big thank you to Maher and our nursing team on how we have actually transformed ourselves over time. Maher is going to have a discussion with myself and Kathy in a little while about the services we run in the community and working particularly with pharmacies. And Kathy, our keynote speaker, is a community pharmacist working in the Meath village of Duleek with more than 20 years experience there. So she owns this pharmacy with her husband, Tom, and Kathy is well known for her work in health promotion and patient education, and firmly believes that helping people become more informed about their health and well-being empowers them. And you'll know when you actually listen to Kathy that she's very, very passionate about this. In recognition for her work in this area, it has resulted in an awards for patient education, community pharmacy, pharmacist of the year, and overall pharmacist of the year. So that's fantastic. So we've got, we've got a superior person here with superior knowledge and 20 years experience on a daily basis, face to face. Kathy has been extensively involved in the Irish Pharmacy Union for 20 years and was president of this union in 2014 to 16. She continues to be one of their media spokespersons, and I know from talking to Kathy, she's been very busy, and you've probably heard her on radio and TV, or radio this week particularly. But again, advocating for health services, advocating for pharmacy services, they are so valuable. We're going to learn that, and particularly for men, I think, Kathy, we're going to focus in there. So I'm going to stop sharing my screen now. Kathy, you're very welcome. We're delighted to have you here with us, and I'll stop sharing, and then you can, and I'll go off screen in a minute.
There we go, Helen. Thank you. Is that coming out clear there?
We can't see it yet, Kathy.
Okay. Sorry.
Not at all.
Whilst I love pharmacy, technology is not my strong point.
We've all had to learn it, haven't we, over the last 15 months for sure.
Haven't we just?
Yeah.
Is that there now, Helen?
No. So
I'm going into share screen.
Yeah, and then you might have to, there's a button on the bottom there, blue share button that you might have to press.
Yes, sorry,
yeah, and then you finally get perfect.
Now we're here. And this is why I do pharmacy and not technology. Okay, thanks very much, Helen and Mary and Ava, and thanks a million for the invitation. I'm really passionate about education patients, helping people along their journey of all health stages, and not just the cancer stage. But we really want to focus in on this for tonight, and I have to commend the 4-week webinar series on focusing in for men and health and well-being. I love to see men looking after their health, and also my part-time days, I also teach yoga, and I have a 50% turnout of men, and I love to see men coming in and looking after themselves. But however, that's taken certainly 2 decades in my experience to get there. And we often sit back and think, why are men more reluctant to seek help? And there are various barriers, and there's lots of psychology done around it. But very often it's to try and break those barriers down within the informal setting of community pharmacy, and to look at moving away from fears, the fears of false alarms, the fears of time wasting, the fears of this is only really minor. And what has been shown time and time again is that men do tend to delay in receiving advice for health conditions or health problems, and the problem there can be that the problem itself may become more serious and more sinister. So we try to engage at the very, very early stage. Pharmacists are really there trying to make every contact count. So we use every opportunistic conversation to try and reach men, or reach men through whoever is the representative in the pharmacy for them, whether it's a partner, wife, sister, daughter. I've had conversations with them all about the men in their lives and things that we can do. So When we think about what your pharmacist does, pharmacists are healthcare professionals. We're clinically trained and highly skilled, and we are the medicines experts. And this is something that we keep trying to remind patients, because we're the expert in the medicine that you use, whether it's your prescription medicine, whether it's medicine that you get across the counter without prescription that you need advice on, whether it's a homeopathic or herbal product. Everything has an interaction potential, and we need to know everything that you're taking or wish to take. So we are your medicines expert. We do encourage people to use the same community pharmacist as much as possible, because we're the one professional that has access to all of your prescriptions. So certainly on your cancer journey, you'll have your oncology team. You may have other health conditions or other chronic conditions, or the things that pop up that you have to go to the GP for or go to a cardiologist for. So all of your prescriptions come back to the one point of contact, and that's us in the pharmacy, to make sure that where possible, you do use the same pharmacist. We tend to be the first point of contact, and especially between men and the medical world. And we are shown that pharmacists have a direct role in referring red flag symptoms. And they could be symptoms for us, they could be symptoms of potential cancer that for us mean that's an urgent referral. And we're very skilled at showing people and encouraging people how to go and seek help. So things like perhaps a persistent cough that has lasted for more than 3 weeks, or perhaps it's unexplained heartburn that could be not explained away by food or diet or lifestyle or anything else, or medicines. Blood in the urine, as Helen outlined, persistent vomiting, vomiting blood, rectal bleeding, and we even get down into colours and when and where, and we really drill down into a lot of detail, but we do it in a way that doesn't feel invasive. Whether there's difficulty or pain in swallowing, unexplained weight loss, any skin changes, moles, lumps and bumps, and believe me, every pharmacist out there has seen everything. It's absolutely no difficulty. There's no reason to be embarrassed or ashamed or coming into us. We don't judge. We're there as the gatekeeper to say, actually, there's a self-management role we can play here, or perhaps we need to get this investigated further. We can give the reassurance that we think it might be okay, it might not be okay, and we can help expedite that. The evidence is out there to show the pharmacists do play that critical gatekeeper role. And one simple study in London in 2012, just a pilot study, showed that out of 60 men that had symptoms suggestive of lung cancer, 55 of those referrals, urgent referrals, turned out to be appropriate. So that's really, really important. And of all of the men, 14 of them turned out to have a COPD, chronic obstructive pulmonary disease. So there showed that pharmacists play that critical gatekeeper role. And very often those conversations just come about by, how are you? It's a lovely day out there. And you might answer me with, yeah, it is, but I have a bit of a cough and it's going on a while. And we are highly trained that we can actually glean an awful lot of information out of a 4 or 5 minute conversation, and are skilled enough to actually say, right, well, let's talk about that. We did remain open as a profession. We were the only accessible face-to-face healthcare professional for, especially in the early days of COVID. And it was very, very challenging for cancer patients who were really felt bereft and at sea and trying to isolate them. And certainly pharmacies up and down in the country jumped into the cars and their vans, whatever they did, and they delivered medicines left, right and centre. There were many nights that we weren't coming home from work till 8 or 9 at night having delivered to what we needed to, because we wanted to make sure that our patients were well. In terms of the cancer patient, we're there from the very, very start. We want to make sure that you understand the condition, the treatment, medicine schemes. If you're landed with a very serious diagnosis, suddenly you're thrown into a lot of jargon, a lot of medical speak, a lot of terminology, blood tests, markers, what does this mean? And then into medicine schemes. And you might hear people talk about the drug payment scheme, the GMS scheme, the hardship scheme, discretionary scheme. And that's really, really hard to get your head around when you're trying to understand the diagnosis that you've just received. So we are there every step of the way to explain absolutely everything to you, not just your medicines, but everything else, to make your quality of life and your journey through this as easy as we can. This is just a very quick diagram to show, on average, the average pharmacy is open about 56 hours. I think we're open about 60, 65. Most people make average 18 visits to a pharmacy a year and 78 million visits to pharmacy in Ireland. And the Ipsos MOPI poll in 2020 rated us the second most trusted professional in Ireland. And actually the latest one of this, I think throughout the pandemic, we actually, sorry Helen, but we managed to overtake nurses in the 2021 survey. I think that was the support that we give to the public. And this is just, again, like we constantly evaluate ourselves. So just to let you know that the satisfaction of the public is there. 98% do trust the advice and care that they receive from their pharmacist. And it's been shown that Ireland in particular is really, really loyal to their person, their community pharmacist. There might be high street pharmacies, big chains, but people value, 96% value the advice of their pharmacist, and 98% of the public are satisfied with the service that we provide. But how can we support men? And exactly as Helen said, supporting men and boys to engage in healthier lifestyle choices and activities. And we start that when we engage with parents, and they're coming in and they're asking advice around sports, around injuries, hay fever. We start talking about boys' health from very, very early on. And actually, when young people, young children get to a certain age, in pharmacy, you try and direct the conversation to the child themselves, to try and give them ownership and empowerment around their own health. But we support men and boys to engage in healthy lifestyles. We use simple conversations to start health awareness, and that could be as simple as someone collected a prescription for their father who's discharged from hospital after a heart attack. And you're obviously quite upset, and I'll say, okay, and how are you doing? And have you had your own blood pressure checked recently? What's your own cholesterol like? And we'll just do that to start those conversations. Or if there's been a cancer diagnosis within the family, we just check around it, particularly if it's a hereditary or genetically prone cancer. We'll talk around that, because I firmly believe that we encourage early detection and early treatment. Obviously, the prognosis, the outcome, the quality of life, and everything is better. So the more that we heighten preventable illness, the more that we can treat it at an early age. And we want to live with illness rather than die from symptoms. We want to live in wellness. There's a worry, especially there's a high female employee rate within pharmacy, and there's a bit of an awkwardness at times coming into the pharmacy. Just to reassure anyone out there that confidentiality is the utmost importance in your pharmacist. It's binding, it's within our code of conduct, and your pharmacist is always approachable and always ready to help. Every pharmacy by law must have a consultation room. That came in I think 2011, and it must be visually private and it must be audibly private, so no one can see or hear what goes on in there. And that's to give you the reassurance that whatever is there, we take your condition, your worry, your fear seriously. We'll give you the time and dignity that it deserves. Your pharmacist is approachable and always ready to help. Within the pharmacy structure, when you walk in the pharmacy first, you do tend to see a bit of the makeup and the aftershave and the toiletries first. But the over-the-counter area, the medicines counter, the consultation area are all there. And all of our staff are very highly trained. You might have a conversation with one of the counter assistants. They're also trained in certain levels of red flag symptoms. They'll go, actually, this is beyond my scope, and they'll come and get the pharmacist very, very quickly. And it could be a case where that they've noticed you've bought something as simple as Gaviscon for ongoing heartburn, and that actually might raise, no, do you know, he bought that for me last week and the week before. Maybe there's something we need to have a conversation about, and they will reach out to the pharmacist. Pharmacists are also really skilled. We multitask really, really well, and 9 times out of 10 of the conversations that go on at the medicines counter, I hear anyway, and I'm ready to intervene just at a moment's notice, very discreetly, but we do it. Behaviour and Attitudes are a market research company, and this is just some of the statistics that Helen has already brought up. But 52% of men in Ireland indicate they do live with at least one significant health condition, and they're listed there. But I think what's really important in this slide is if you look at the very bottom, 42% of men experience healthcare impact on top of whatever else was going on due to COVID-19 restrictions. That includes weight gain, mental health issues, alcohol consumption, and a general reduction in confidence. When we look at weight gain and alcohol consumption, obviously there is a link to cancer, and there's a link to what we can do there for ongoing, even cardiac health. So we're there to try and intervene at those early stages. Pharmacists also run, as Helen said, a lot of education events, and we tend to, obviously pre-COVID, we tend to run an education or health promotion events at least once a month in a variety of topics. And we find very much the more that someone can take ownership of the information, that the more likely to comply or stick with the advice that they've been given, the more likely to ask questions about the advice. I encourage every single one of my patients, no matter what the condition they're being treated for, if they've been prescribed a medicine, ask their pharmacist, what is this for? If they've had their blood pressure taken in the pharmacy, if they've had their blood pressure taken by the doctor, I'll always say to them, and what was your level? Know your numbers, know your figures, get familiar, because the more that you can own in that information zone, the more we can help you and the more empowered you are for your own health. But within pharmacy, we're very accessible, as I said. The opening hours are extensive. Many are open beyond 6 o'clock in the evening, beyond all other healthcare services finishing. In our own pharmacy in a rural town, we're open to 7 o'clock Monday to Friday and 9 till 6 on a Saturday. And we do find that 6 to 7 slot, we do tend to see quite a lot of men on their way home from work, and they might pop in. We're fortunate that we have 2 female and a male pharmacist, and sometimes they might pop in, want to have a chat with Tom, or they might want to have a chat with myself, and that's absolutely fine. That flexibility is there. In terms of flexibility, to walk in, we are the only healthcare professional that's so skilled and clinically trained where you can talk to us without an appointment. Just literally walk in, get some advice, get the direction that you need, and be very satisfied. You can pick up the phone and other means. Because of COVID, we've all become much more tech savvy, and we've had people contact us through social media, through even just texting, through whatever means they can. Sometimes they'll send in a mobile number and I'll say, okay, I'll come back to you. I prefer to have a conversation with that. Oftentimes, a partner, a wife, a sister, a daughter will come in and say, look, I'm really concerned about such and such, and he's complaining of this symptom, perhaps bleeding, perhaps moles, whatever the symptom is, and I'm concerned. But he's satisfied that there's nothing to be worried about, and what do I do? So I glean a little bit of information and I'll say, ask him to pop in, we'll have a chat, and give the reassurance that way. Or if they don't want to do face-to-face, we'll do it by the phone. There's no problem. That informal setting, that non-threatening environment makes it really easier to break down some of those barriers to accessing help. It's always a relaxed and approachable service. And what's really unique about pharmacy is that it straddles private and public system. It makes no difference to your wait time, to your conversation length, to anything at all, whether you pay for your prescriptions, whether you have a medical card, or whether you even need to exchange any money whatsoever. My time is still yours, and the information that you need is still mine to give. So we can still absolutely sit down. There's no payment for that. And that's really unique with a healthcare professional. So that's to give you all a lot of reassurance that we're there all the time for you. And as I said, the consultation room is there by law. Services that we provide within the pharmacy, and these can be pharmacist specific depending on your own local pharmacy. Most of these are general, but it's worth asking in your pharmacy what they provide. Medicine and health advice, that's the core of what we do. We do dispense prescriptions all the time. And it's not simply enough for your pharmacist to dispense your regular repeat prescription without ever a conversation. If you've been on a medicine for 6 months for blood pressure, say, or for asthma, it's not enough. And if you feel that any of your healthcare providers haven't stopped to say, how are you getting on? Is there any side effects, any dose problems? Is there anything that we just want to have a chat about? Regularly enough just to have that chat. We also look after minor ailments, things that are just the lumps, the bumps that we can deal with, usually self-limiting, self-management. They can be sometimes minor enough that they'll pass, or they can be minor and if not treated, can become a bigger problem. So that's where we say, that's what we do. And there's nothing too trivial for us to look at. And in my day, I'd very often be dealing with a very, very serious patient and case. And the next conversation could be about Calpol. And the next conversation could be to go and look at a toe. And the next one could be a child that's fallen off a bouncy castle and might need a referral urgently into hospital. And that's what we do. We're used to actually adapting and working very well with the patient that presents in front of us. And all of my time will go to that patient that I'm with there and then. Many pharmacies provide cardiovascular screening in terms of blood pressure measurement, cholesterol testing, BMI measurement, and smoking cessation. And as Helen alluded to, some of those are very strongly linked in with cancer. And everyone that has a cancer diagnosis, we will tend to go through some of those questions anyway, just to see if there's anything else that we can do to help improve their quality of life. In terms of men's health and cardiovascular screening, some of you may or may not know that Viagra has now been made available without prescription. And Ireland is quite a slow country to make medicines available without prescription. But erectile dysfunction can be a symptom of a cardiac problem, particularly in younger men. So we use the opportunity of questions that have asked us to for sale of Viagra to actually go through some cardiac questions as well, because we may pick up an issue that hasn't been found somewhere else. So it's really important. So our questioning skills and the protocols that we use are really good to try and help prevent illness in later life. Vaccination service. We've been delivering the flu vaccination for over a decade now, and just in the season past, September and October of 2020, we delivered 25% of all the flu vaccines in Ireland, and actually could have increased on that, only there was such a short supply. And then the COVID vaccine, and COVID vaccine started in pharmacy just 2 weeks ago in about 800 pharmacies, and we're currently delivering the Janssen single shot vaccine, and that's currently in the over 50 age group, which has been really overwhelmingly positive. We were surprised at the response, because on one point we thought, are there any over 50s left? But actually the amount that waited for their pharmacy because they had had their flu vaccine with us before, they knew it was a trusted service, or they waited for the single shot vaccine, or actually they were a little bit hesitant and thought, you know what, it's in the pharmacy, I know it'll be okay, it's close to my home, I'm okay. So hopefully that cohort will be extended, and then about 350 pharmacies within the next kind of 2 weeks will start delivering the Pfizer vaccine. And we're delighted to be one of those, because we're in a rural area. We're not close to any of the mass vaccination centres. So again, we've lists and lists of people that want to avail of that. And COVID's going to be here. The pharmacy want to be front and centre to allow people live lives and move on through this. We're also there to discuss any health aspect, and nothing, as I said, is too minor, nothing is too serious, nothing to be embarrassed about. I've seen every lump and bump possible in every area of any body. So, and that all happens within the consultation room. So there's no fear or barrier should be there. And signposting. Signposting is it's a funny word, and you kind of wonder what's that for, but within our own service. So if I have a patient who has a cancer diagnosis and they're beginning on their chemotherapy treatment, and then I think, well, I'm not really sure where to go for some counselling, or I'm not really sure where to access some WAKE information, so I can signpost them into the Wake Keating Foundation or a local service to myself, or just really, we act as the one-stop shop, and then referral, as I said, for some of those key issues. In terms of how we can help men with cancer, and when you think of your prescription, medicine names aren't easy. They're not easy for anyone to pronounce or look at, and you think, what does that mean, and what strength does that mean, and why do you mean, you know, even down to the basics. If I have a prescription that's labelled take 1 3 times a day, I can't assume that everyone knows what 1 3 times a day means. For some people it might mean breakfast, lunch and dinner, when actually what I mean to say is 1 every 8 hours. So we spend the time and go through with people, particularly with cancer, because usually there's such an amount of medicines to take with complicated instructions on what times are best to be taken, whether it's before or after food, what side effects to expect. Some of this information might have been given to you during your diagnosis or during the treatment decisions, and it's really hard to take those in when you're trying to process other information. So the pharmacist is there as the second or third information person, and that's what you might go home and think, I've forgotten what the consultant said or what the nurse said. Maybe the pharmacist will know, and we will pick up the phone to us and say, actually, I forgot, is that the one before or after food? Is that the one that makes me sick? Or will that one cause constipation? And if it does, what do I do about it? And they're the conversations that I have dozens and dozens of times a day. And that's fine, that's what we're there for. There are other things that you might have to do, some of the high-tech medicines, and some of you might be using high-tech medicines in terms of maybe some prostate cancers. And you might have to do a self-injection technique, and that's not pleasant, and it's not easy to understand, and you might need some help and guidance around that, and we can help with that. And we can help reinforce how the medicine is to be taken, when it is to be taken, what side effects might occur. Oftentimes we find when people experience side effects of medicines, they just go, that's it, I'm done with that, I'm not going to take that anymore. And actually we might be able to say, oh, with that medicine, that side effect passes within the first 48 hours. So if we just ride with it, it might be okay. Or might say, actually, you're right, that side effect is never going to go away. It's going to impact on your quality of life. Let's get it changed to something else. And we can be the phone call to the GP or to the oncologist or the oncology nurse, or whatever phone call needs to be made. The pharmacist can do that on your behalf, because it's really difficult to pick up the phone and say, this isn't working for me, because you don't want to be bothering the hospital team, the nurse team, and there's a bit of that. So actually we can do that for you and make it easier for you. And as I said, in terms of other medicines, prescription medicines, so they can be prescribed, don't assume that your oncologist speaks to the GP or that they speak to the cardiologist. All the teams can be somewhat a little fragmented, which isn't ideal, but it can happen. And they're only really looking after whatever they're looking after, and they're not thinking about your other medicines. So it's really important that we know everything that you're taking, so we know what is safe with the treatment that you need to take. And that goes for prescription, over-the-counter medicines, and any herbal. Oftentimes people think, for sure, it's only herbal, it's only a plant, it'll be okay. But there's actually quite a lot of serious interactions with herbal medicines, and it's always, you need to let us know what you're taking. We have our pharmacies in County Meath, so very often I have people that might travel north and buy medicines and come back to me that maybe are prescription only here and are available without prescription in Northern Ireland. And again, I'd have to say, no, we have to make sure that it's safe with your treatment. And if needs be, I can liaise in with your care team and just say that they're happy with that too. Nobody's going to make any judgments. We just want to make sure that you have the best treatment and the best quality of life. The government drug schemes, they're really, really confusing. And the last thing you need to hear when you've had a very significant diagnosis, like a cancer diagnosis, is how, number one, how much the medicines cost, and number two, how to go about trying to save money or get them without a cost, and the hoops that unfortunately you need to jump through to do that. So we help as much as we can with patients to understand the drug schemes, to understand how they'll work, any costs involved with the drug scheme. With the drug payment scheme, there is a threshold payment. With the medical card, there is a levy charge, but that we go through all of that with you and try and get the best system that works for you within your means. And oftentimes, if I have someone who has difficulty filling in forms, I'll do it for you. It just, whatever is easiest for yourself. And then, as I said, we are your key link between all of your healthcare workers. So it's important to use the same pharmacy when you can. Questions that I ask everybody, but particularly patients who have a cancer diagnosis, because the medicines can be so serious. It can be a little bit more complicated. So always ask if you haven't asked during your consultation with your prescriber. And you know what, I actually recommend everyone to bring in a piece of paper and a pen. And even sometimes they come to me before they go for their appointment with their oncologist, and we go through some of the questions that have come up in maybe the month or so since I've been in. We're going, don't forget to ask this, and remember we were chatting about this, so ask them that. But come away knowing what your medicine is called, having a fair idea of how it's going to work. And it doesn't mean that you know what enzyme it's going to work on and what mechanics, but actually this one's going to be my anti-sickness tablet, or this one's going to be my painkiller, or this one is my steroid and I take it before my chemo. And how should I take it? Is it an oral tablet? Do I need to drink plenty of water? Some medicines can be taken with water, but you might need to remain standing for so many minutes afterwards, that kind of thing. What to do if you miss a dose? And there can be a query around that. Sometimes it's safe to take the next dose at the same time as the missed dose. Sometimes actually we need to class it missed and skip it altogether. And that varies depending on the medicine. So if there's any query at all, talk to your pharmacist. What time of the day should I take it? And even simple medicines or simple directions to us or to a doctor. And sometimes you have to remind us or catch us out or point it out to us. If we just say, take one in the morning, sure, you could be up at 6, or you mightn't be up till 11, and you might need to take it at 8. So that's really important. What time of day should I take this medicine? So take one in the morning really isn't enough to be given as a direction. The clearer we can make it for you, the more likely you're going to take the medicine and the more positive your outcome is going to be. Should I take it with or after food? That can vary depending on the medicine, and you might find that sometimes it mightn't be important, but actually symptom-wise or side effect-wise might help. Are there any activities, foods, medications, anything I need to avoid while taking this medicine? And what are the possible side effects, and what side effects require calling my doctor? So there might be some side effects such as maybe mouth ulcers or high temperature. There might be some things we go, actually, you might call me and I'll go, no, that's pretty urgent, so I need you to call your team, or we'll call your team for you and we'll go through that. So I suppose the main thing is not to sit back and think, you know what, I won't ring them today, I'll wait and see for another few days because actually it's probably nothing and I don't want to bother them. because that's what we're there for. We're there to make sure that your medicine's not just to dispense the medicine to you, but actually make sure to help you get the best out of your medicine, to make sure that your medicine is safe and effective and it's for the right person at the right dose, but that you get the best out of it as well. So as just before we move on to questions, as Helen was saying, in terms of the Marie Keating Foundation, we have worked with Marie Keating Foundation for a number of years, and we've always had very successful health promotion days when we get the mobile unit to the pharmacy. And we've tentatively, post-COVID, put a date in the diary for August 13th where the unit will come to the pharmacy. And the success of those days is that we spend about a month talking to patients about the unit coming, and if there's maybe a few people reluctant to have a symptom checked out, but they may go along to the unit and speak confidentially to one of the nurses, or perhaps they've had a recent diagnosis or a loved one has had a diagnosis and they just have some queries and questions. But the unit sits outside the pharmacy, so I don't know who's gone in, and that reassurance, even that extra layer of confidentiality for people. Actually, oftentimes the nurse would come into me and I'd say, God, I'm really sorry, you've been really quiet today. And she might say, no, I've had a dozen people in and it's only midday. So that's great. That means that's a dozen people that have had some sort of help and advice and guidance. And if that makes a difference even to one of those people, for us, it makes the entire day worthwhile. So if you know anywhere locally to you that the unit is coming out, absolutely go in and get the information that you can. But if not, pick up the phone. Your pharmacist can answer anything for you. Okay. So any questions? Obviously pop out. I think there's a few questions in the chat box.
Yeah. Will we stop sharing, Kathy, and I'll bring Mary in as well? That was an amazing presentation.
Pause share. Really see. It's back to my technicals again. Is he stop video?
Yeah, stop share.
Sorry, let myself down again. Here we go.
No, you can't. But Mary, I'd like Mary to come in. Mary, if you could, that'd be great as well. Hi, Mary. How are you?
Yeah, hi, Helen. Hi, Kathy.
Hi, Mary. Is it okay, Mary? There's just a couple of questions there. I might just
but I suppose first that was amazing, Kathy. I think that's really good for people to hear, because even we're healthcare professionals and we have a good idea of what you might and might not be providing as a service, in the pharmacist, but actually not at the level, there's such a holistic approach to care there. It's second to none, isn't it? If somebody is afraid of going to their GP, or they just want to turn up and ask you some questions. And I love the idea of you actually helping them with questions before they go to their oncologist, because we see that and we hear that an awful lot, don't we, Mary? That people don't know what questions to ask. They get overwhelmed. So that's really, really, really good to hear.
Yeah. Oh, thank you. I suppose some of the questions, one of them that has come in is, can pharmacists take blood pressure? We do all the time, actually. Some pharmacies, we do it through different ways. Sometimes the GP might say, look, I'm a little bit concerned about your blood pressure, so maybe monitor it for 2 or 3 weeks and then come back to me. So if you don't have a monitor at home, the place to go to is your pharmacy. Or sometimes through just through conversation, someone might come to me and describe certain symptoms, and I think, gosh, I would like to actually check your blood pressure before I go much further. We very often have had to send someone straight into A&E or call the ambulance, or a few different things where we've had maybe worrying events, but also ones we can go, actually, do you know what, your blood pressure is fine, so I know that headache isn't related to your blood pressure, perhaps it's a sinus infection. So it can be to reassure or to actually alert us. So there's that, but also other pharmacies might actually, including ourselves, can also offer the 24-hour blood pressure monitor. So it's the very same one as the GPs. You can come into us, we can strap it on, come back the next day, we can go through the readings. And if you're going into a consultant's appointment or into the GP, you have all this information with you and you understand it, which is really, really good.
Excellent.
Just a quick question on how long does it take to train to be a pharmacist? In my day, it was 4 years, now it's 5. Yeah. So, and then do you advise patients on chemo tablets about extra flushes of the router, chemotherapy and storage? Yeah, we can do. So that would be dependent on your treatment. So check that with your pharmacist, absolutely.
There's a couple of questions coming in from Facebook there as well, okay, Kathy, if you don't mind, before we talk to Mary. So I mean, you've mentioned this actually in your talk about chronic pain and illness, and how do you support people who come to the pharmacist with those kind of like chronic issues?
Chronic pain generally, do you think, Helen, or chronic pain around cancer treatment?
I would say
around cancer.
Probably around cancer, but it's not specific.
So what we generally tend to advise would be round the clock, round the clock pain relief, and not to wait until pain becomes too much. And I've noticed, obviously I'm from the north, but I've noticed Irish people in particular are like, I'll keep those there until I'm ready to take them, until I can't bear it anymore. And what we would say from your quality of life point of view, why not get ahead of that and don't let it come to that point where it's unmanageable? So round the clock pain relief is really, really important. And it's as simple as taking a therapeutic dose. So 1 paracetamol is not going to cut it for an adult. It'll be 2 paracetamol and 2 paracetamol every 4 to 6 hours. That's okay. People have a fear that they're going to be dependent on it or they'll become immune to it. And we help allay all of those scenarios. That's not the case. But actually it will do. It'll take the edge off that pain. It might not treat it completely. And usually, and depending on the cancers and depending on whether it's a bone pain, a visceral pain, or medicine related pain, it depends on each one of those. You may have a variety of pain relief. And we will go through the timing of each of those because they all work very well in their own way. Medicines only work when they're taken. So you're best to take them, especially for pain, round the clock. Don't let it become unbearable.
Yeah, no, we've all had experience with that, I think, in looking after people in pain. And it's as you say, it's like they just, they feel that they're going to become dependent on or mask the pain so they don't know they have it. How good would that be? But it's difficult, isn't it?
And it's difficult. So we try and just balance it up with actually let's manage that so you can enjoy the day that's ahead of you or enjoy what you want to do.
Yeah. There's another question here. Do you think it's easier for a man to speak to his pharmacist than a doctor initially?
I think so. I'd like to think so actually, because with us, because you don't have to pick up the phone and make the appointment, that in itself, even after times people have spoken to me, and I might see them 3 or 4 weeks later and I'll say, I've referred you to the doctor. Did you ever go in? Oh, no, I didn't. Because even that barrier of just picking up the phone and making the appointment can be just not done. So at least with us, we're there. I'll always ask someone to say, come back and let me know how that's going for you. And even that little bit of actually a bit of accountability in their own health is useful. But we're there if they happen to be buying blades and just general conversation. It's much more easy because there's no appointment needed. We're there at regular times. We're there on Saturdays, some Sundays. It just depends. So it's definitely much more informal.
It's quite opportunistic, isn't it? It's a bit like the service we run, Mary, like in the community. I guess I might just bring you in there for a minute, Mary, and just ask you about the experience of working in the community with the mobile unit as a nurse and working in partnership with the pharmacists. How does that work?
And I just have to say, I fully endorse absolutely everything that Kathy has said, both in terms of my professional relationship, working in the community with pharmacists, and also my own personal experience with pharmacists. But generally, as Kathy and Helen have said there, we have the 3 mobile units, and I work in the Western region. So I cover the Western region, and probably most of my work, 60% of my work, before the lockdown, and certainly that space we had a period there where we opened up briefly before the Christmas period. Most of my work would have been with pharmacies. So whether it's health promotion, as Kathy mentioned, or whether it's a specific campaign, we bring the mobile unit along, and I have to say the pharmacies go to such lengths to accommodate us. First of all, Helen showed what the mobile unit looks like. So it's quite a big camper van type facility, and it's got 2 rooms, 2 spaces in it. And again, the pharmacists always make sure there's room available. They also go to a lot of trouble in terms of, putting on a day for their clients and their patients. They might have tea and coffee available, depending on the campaign that's being run. They may well decorate the pharmacy, for men's health, for women's health, and certainly for skin health. So really, really good. And we have a fantastic relationship and partnership with pharmacists. So thank you, Kathy, on behalf of myself and all of us who work with you.
Thank
So,
you. Yeah, no, it's a fantastic partnership to have. I think I really like the idea now that we have, you know, a recorded webinar here, resource that we can actually put out to the public, and hopefully allow the public to realize that, you know, especially when we're coming out of the pandemic, that there still is a fear, you know, of going to hospitals, of going to GPs. Our message has been clear all along. If you notice something wrong, please go to your doctor or go to your pharmacist. And that persistent cough is one, you know, we did a campaign last year on that persistent cough, because is it, you know, a chest infection? Is it COVID related? Is it chronic, or is it cancer? You know, and like it's actually quite overwhelming, isn't it?
It really is.
To be sick in this space and in this time. So
we have had several conversations, certainly I can think of quite a few in the past, maybe 3 months, of more worrying symptoms that I would like to have been seeing 6 months ago. So definitely would urge anyone that has a little niggle in the back of their mind, they don't want to go to the GP, pop to the pharmacy, and we can direct you. Sometimes it can be as much as reassurance, they're going, actually I know it's there a while, but we can manage it, or it might be, no, we need to go further.
Yeah, and I think that's the message we're going to leave on tonight, isn't it? So, you know, if you notice any changes in your body, you feel unwell in any way, or you're feeling different, go to your pharmacist. In the first instance, look at all, you know, the support that is there. We've talked about it tonight. We've heard all about it. And come to us as well in the McKeating Foundation. And a great date we had, hopefully on the 13th of August, where we'll be working together in partnership in Duleek. So we'll all look forward to that. Great. I'm going to leave now, I suppose, with a conversation with a comedian around prostate cancer, because that's sometimes, you know, a lighter way of starting a conversation and being part of, you know, men's health and engaging in a different way. So just bear with me now a minute and we'll move into that. Thank you so much, Kathy. Thank you so much, Maher, for being with us tonight.
Thank you.
And we'll leave you with Al Foran.
Okay, prostate cancer. You are 2.5 times more likely to get it if it's in the family, okay? Or if your sister or your mother has breast cancer, okay? So that's reason enough to get it checked, okay? Blood test, simple. If you're not doing that, then, well, simply we have a f***ing problem, okay? It's like we have a problem in the kitchen, okay? You know, the lamb was burnt. That's a problem, okay? If you have the symptoms of prostate cancer, that's a problem, okay? Get it checked, okay? Right, now
Let me give you my raw and honest opinion on prostate cancer. It's curable. It's treatable. Go to your doctor. Don't be an idiot. And let me tell you something, I'm small. I'm very small. But if you have a small prostate, that's good. That's good. If you have a big prostate, not good. You know what I mean? So a lot of people say you're too small. You're too small for certain roles. I say go f yourself. You know what I mean? I want an Oscar. Small prostate, good. Small actor, good. What more do you want? What more do you want me to say? Get it checked. Don't be an idiot. You mutt. 1 in 8 men will be diagnosed with prostate cancer in their lifetime. 3 in 4 men will not speak to their doctor about prostate cancer. I have won 3 Premier League titles, but that is for another day. I think what's very important for men and men over the age of 50 is to get their prostate checked. Don't take my approach like what I do with football now and park the bus. Because the way I view the prostate, you know, I am the special one, and the prostate is the special gland. Some men have this kind of macho personality about them, you know, and they have a stubborn personality as well. But I just take that for weakness. I really do. You know, a strong man You know, a masculine man, you know, goes to his doctor, gets his prostate checked. You know, when they get it checked, it's pure bravery, and when they speak out, it's bravery. And that's what's important about getting the prostate checked.